Question 1. Mr. Thompson, a 72-year-old dialysis patient, has been receiving hemodialysis treatments for the past 6 months. During his treatment he begins to feel lightheaded and his blood pressure drops significantly. The dialysis nurse notices that his face appears pale and he is complaining of nausea. What should the nurse do immediately to address Mr. Thompson's symptoms? A. Administer a dose of diuretic to relieve fluid overload. B. Decrease the blood flow rate on the dialysis machine and administer saline bolus. C. Increase the blood flow rate on the dialysis machine and monitor closely. D. Stop the dialysis treatment immediately and administer vasopressor. Answer. B. Decrease the blood flow rate on the dialysis machine and administer saline bolus. Explanation. Mr. Thompson is exhibiting signs of hypotension, which is a common complication during hemodialysis treatments. The appropriate response is to reduce the blood flow rate on the dialysis machine to decrease the likelihood of further fluid removal, which may be contributing to the hypotension. Administering a saline bolus helps to restore intravascular volume and improve blood pressure. Option equals diuretic administration is incorrect because diuretics may further reduce fluid levels, exacerbating hypotension. Option C, increasing the blood flow rate, would be harmful as it could further decrease blood pressure by accelerating fluid removal. Option D, stopping dialysis and administering vasopressors is not recommended as the first step because fluid replacement should be the priority and vasopressors are typically used as a last resort for more severe hypotension. Question 2. A dialysis nurse is preparing a patient for peritoneal dialysis. The nurse is explaining the process of dialysate, infusion and drainage. Which of the following statements made by the patient would indicate the need for further education regarding peritoneal dialysis? A. I will need to make sure the dialysate is warmed before I begin the infusion. B. I should avoid touching the catheter insertion site during the exchange process. C. The dialysate must be infused very quickly to remove toxins efficiently. D. I should check the color of the drained fluid to monitor for signs of infection. Answer. C. The dialysate must be infused very quickly to remove toxins efficiently. Explanation. Option C is incorrect because dialysate infusion should not be rushed. Peritoneal dialysis relies on diffusion and osmosis to remove waste products and excess fluid, and the infusion rate should be slow and controlled to ensure adequate time for these processes to occur. Rapid infusion could lead to complications such as discomfort or DEM. The peritoneal membrane. Option is correct as warming the dialysate prevents discomfort during the infusion and helps with better diffusion. Option B is also correct because maintaining sterility at the catheter insertion site is crucial to avoid infections. Option D is correct. The nurse should educate the patient to monitor the drained fluid for any signs of infection, such as cloudiness or unusual color, as this indicates peritonitis. Question 3 scenario. MS Harper, a 58-year-old patient, has been on hemodialysis for 2 years. During her routine dialysis session, she suddenly begins to experience chest pain and shortness of breath. The nurse suspects an air embolism and immediately checks the dialysis machine. What should be the nurse's first action in response to these symptoms? A. Increase the blood flow rate to quickly remove the air from the system. B. Clamp the dialysis blood lines and place the patient in the Trendelenburg position. C. Administer oxygen and perform cardiopulmonary resuscitation (CPR). D. Flush the dialysis lines with saline to remove the air embolism. Answer. B. Clamp the dialysis blood lines and place the patient in the Trendelenburg position. Explanation. In the event of a suspected air embolism, the nurse's immediate priority is to prevent further air from entering the bloodstream. Clamping the blood lines immediately prevents any additional air from being drawn into the system. Placing a patient in the Trendelenburg position, head down, feet elevated, helps to trap the air in the right atrium and reduce the risk of it traveling to the lungs or brain. Option. Increasing the blood flow rate would exacerbate the problem, potentially pushing more air into the bloodstream. Option C. Administering oxygen and performing CPR is not immediately indicated unless the patient shows signs of respiratory or cardiac arrest. Option D. Flushing the lines with saline could introduce more air into the system, which is counterproductive. Question 4. A 68-year-old patient undergoing hemodialysis begins to show signs of dialysis disequilibrium syndrome (DDS) after the initial phase of their treatment. The patient is experiencing headaches, nausea, and restlessness. The dialysis nurse suspects DDS based on the clinical presentation. Which of the following actions is the most appropriate for the nurse to take to prevent or manage EDS in this patient? A. Increase the blood flow rate to remove toxins faster. B. Decrease the blood flow rate and slow down the dialysis process. C. Administer an antiemetic medication to relieve the nausea. D. Ensure that the patient receives a high-calorie meal immediately after dialysis. Answer: B. Decrease the blood flow rate and slow down the dialysis process. Explanation: Dialysis disequilibrium syndrome occurs when there is a rapid change in the composition of the blood, particularly when toxins are removed too quickly during dialysis, leading to fluid shifts and an imbalance in electrolytes. This can cause symptoms like nausea, headache, confusion, and even seizures. To manage and prevent DDS, the nurse should slow the dialysis process by decreasing the blood flow rate. This allows for a more gradual removal of toxins and helps prevent the fluid shifts that contribute to DDS. Options: increasing the blood flow rate would worsen DDS by accelerating the removal of toxins, increasing the risk of severe symptoms. Option C: administering antiemetics might be appropriate for managing symptoms, but it does not address the underlying cause of DDS, which is the rate of dialysis. Option D: high-calorie meal post-dialysis is not an appropriate intervention for managing DDS directly and does not address the rapid toxin removal causing the symptoms. Question 5. During a routine dialysis session, Mr. Lee, a 50-year-old patient with chronic kidney disease, experiences significant hypotension accompanied by dizziness, confusion, and nausea. After attempting to increase the blood flow rate and administer saline boluses without significant improvement, the nurse suspects that the cause of his symptoms may be related to a rapid fluid shift during dialysis. Which of the following is the best approach for managing this patient's hypotension? A. Decrease the ultrafiltration rate and administer a hypertonic saline solution. B. Continue the treatment as planned, as the symptoms will resolve after dialysis is completed. C. Increase the blood flow rate and administer erythropoiesis-stimulating agents (ESAs). D. Administer diuretics to remove additional fluid from the body and manage hypertension. Answer A. Decrease the ultrafiltration rate and administer a hypertonic saline solution. Explanation: in cases of dialysis-induced hypotension, one of the primary causes is excessive fluid removal too quickly, leading to a reduction in blood volume and hypovolemia. Decreasing the ultrafiltration rate helps prevent further fluid loss and restores the patient's blood volume. Administering hypertonic saline increases the plasma volume, helps stabilize blood pressure, and relieves symptoms of hypotension. Option B, continuing treatment as planned, is incorrect because this approach risks further deterioration of the patient's condition. Option C, increasing blood flow rate and administering ESAs, is inappropriate because increasing the blood flow rate would exacerbate the hypotension by removing more fluid. ESAs are used to treat anemia but are not directly helpful for managing hypotension during dialysis. Option D, administering diuretics, is also incorrect as diuretics would further decrease fluid volume, worsening hypotension. Question 6, MS. Alvarez, a 45-year-old patient on peritoneal dialysis (PD), is experiencing cloudy dialysate drainage fluid. She reports discomfort in her abdomen, including tenderness and fever. Based on these signs, the nurse suspects peritonitis. Which of the following is the most appropriate initial action to take? A. Continue peritoneal dialysis and monitor the patient closely for changes. B. Administer antibiotics intravenously without stopping the dialysis treatment. C. Discontinue the peritoneal dialysis, collect a sample of the drained fluid, and start broad-spectrum antibiotics. D. Increase the dialysate flow rate to help flush out the infection from the abdomen. Answer: C. Discontinue the peritoneal dialysis, collect a sample of the drained fluid, and start broad-spectrum antibiotics. Explanation: peritonitis is a severe complication of peritoneal dialysis and is usually characterized by cloudy dialysate fluid, abdominal pain, fever, and tenderness. The first step is to stop the dialysis treatment to prevent further contamination of the peritoneal cavity. A sample of the cloudy dialysate should be collected for culture to identify the causative organism. Broad-spectrum antibiotics are initiated to cover both gram-positive and gram-negative bacteria, as peritonitis can result from either type of infection. Options: continuing PD and monitoring closely is not appropriate, as peritonitis requires prompt intervention. Option B, administering antibiotics intravenously without stopping PD, is incorrect, as the infection is in the peritoneal cavity and the antibiotics need to be delivered directly to that space. Option D, increasing dialysate flow rate, is ineffective in treating peritonitis and could worsen the infection. Question 7. The 60-year-old patient undergoing hemodialysis has been prescribed an erythropoiesis-stimulating agent ESA to manage anemia related to chronic kidney disease. The patient's hemoglobin level is 9 grams still before the start of dialysis, and the nurse is preparing the ESA for administration. Which of the following is the most important consideration before administering the ESA? A. The patient's blood pressure should be checked and stabilized before administration. B. The patient must have blood transfusion before ESA administration to ensure effective treatment. C. The patient's phosphorus level should be checked and corrected to prevent adverse effects. D. The patient must be receiving dialysis at the time of ESA administration to enhance the drug's effectiveness. Answer A. The patient's blood pressure should be checked and stabilized before administration. Explanation. Erythropoiesis-stimulating agents ESAs are commonly used in dialysis patients to manage anemia by stimulating red blood cell production. However, critical consideration before administering ESAs is ensuring that the patient's blood pressure is stable. ESAs can increase the risk of hypertension, especially when starting therapy, so it is important to ensure that blood pressure is within an acceptable range to avoid complications like stroke or heart failure. Option B, blood transfusion before ESA is unnecessary, as ESAs work by stimulating red blood cell production rather than replacing them directly. Option C, checking phosphorus levels, is important for overall dialysis management but not directly related to ESA administration. Option D, administering ESA during dialysis is not necessary for the drug's effectiveness, as ESAs can be administered before or after dialysis. Question 8. Mr. Johnson, a 50-year-old patient with chronic kidney disease, is being evaluated for dialysis access options. He has a history of peripheral vascular disease and has previously undergone a failed arteriovenous AV fistula placement. Which of the following dialysis access options would be the most suitable for Mr. Johnson's condition? A. Permanent central venous catheter, CVC, placed in the jugular vein. B. Hemodialysis, graft using synthetic material placed in the forearm. C. New AV fistula placed in the upper arm. D. Peritoneal dialysis catheter with access to the abdominal cavity. Answer. B. A hemodialysis graft using synthetic material placed in the forearm. Explanation. In patients with peripheral vascular disease and a failed AV fistula, a hemodialysis graft is often the best option. A graft involves using synthetic material to create a vascular connection between the artery and vein, allowing for dialysis access. This option is less dependent on the patient's own veins compared to a fistula. Option with permanent CVC is generally considered a temporary access method, and while it is viable in urgent cases, it is associated with the higher risk of infection and complications when used long-term. Option C, new AV fistula, would not be the best option for Mr. Johnson due to his peripheral vascular disease and prior failed fistula. Option D, peritoneal dialysis catheter, is appropriate for patients who are candidates for peritoneal dialysis, but this is not an ideal choice for someone with vascular access issues or contraindications to peritoneal dialysis. Question 9. A 40-year-old patient with chronic kidney disease is being initiated on hemodialysis. The nurse is reviewing the patient's laboratory values and notices that the potassium level is 6.5 meckel. Which of the following actions should the nurse take to manage this finding before starting the dialysis session? A. Start the dialysis session immediately and increase the blood flow rate to remove potassium quickly. B. Administer potassium binder medication to lower the potassium level before dialysis. C. Delay the dialysis session until the potassium level decreases on its own. D. Administer an oral dose of potassium supplements to prevent further hypokalemia. Answer. B. Administer potassium binder medication to lower the potassium level before dialysis. Explanation. A potassium level of 6.5 meckel is elevated and can cause serious complications, including arrhythmias. Before initiating dialysis, it is crucial to manage the elevated potassium level. Potassium binder medications can help lower the potassium level safely before the start of dialysis. Option starting dialysis immediately and increasing blood flow might remove potassium during dialysis, but it is not safe to delay treatment or increase the blood flow rate too quickly, as it may lead to complications. Option C, delaying dialysis, is not appropriate, as elevated potassium is an urgent concern that requires timely intervention. Option D, administering potassium supplements, is incorrect, as the patient already has elevated potassium and does not need additional potassium. Question 10. MS Walker, a 58-year-old patient on hemodialysis, has been receiving treatment for chronic kidney disease for the past 4 years. During the dialysis session, she experiences severe cramping in her legs. The nurse notes that MS Walker's weight has decreased significantly since the last session and the ultrafiltration rate has been set high. What is the most likely cause of the cramping, and how should the nurse manage the situation? A. The patient is dehydrated due to excessive fluid removal, and the nurse should slow the ultrafiltration rate and administer saline. B. The patient is retaining fluid, and the nurse should increase the ultrafiltration rate to remove excess fluid. C. The cramping is related to hyperkalemia, and the nurse should administer potassium binder. D. The cramping is due to low calcium levels, and the nurse should administer calcium gluconate. Answer A. The patient is dehydrated due to excessive fluid removal, and the nurse should slow the ultrafiltration rate and administer saline. Explanation. Muscle cramping during dialysis is often caused by dehydration, particularly when excessive fluid is removed at too high of a rate. The fluid removal leads to an imbalance of electrolytes, including sodium and calcium, which can cause muscle cramping, in this case slowing the ultrafiltration rate. Administering saline will help restore the patient's fluid balance, alleviating the cramps. The saline solution helps rehydrate the patient, while slowing the ultrafiltration rate will prevent further fluid removal that could worsen dehydration. Option B, increasing the ultrafiltration rate, is not correct, as it would worsen dehydration and exacerbate the cramping. Option C, administering potassium binder, is not relevant here, as the cramping is more likely due to dehydration and fluid loss, not hyperkalemia. Option D, administering calcium gluconate, is inappropriate in this scenario because cramping due to dehydration is not primarily caused by low calcium levels. While hypocalcemia can cause cramping, this patient's issue is more likely related to fluid shifts from excessive ultrafiltration. By addressing the dehydration and slowing the fluid removal, the nurse can help prevent further complications and provide relief for the patient's cramping. Question 11. A 72-year-old patient with end-stage renal disease (SID) and a history of diabetes mellitus is being started on peritoneal dialysis (PD). The nurse is teaching the patient about the procedure and potential complications. Which of the following statements indicates that the patient understands the teaching regarding infection prevention? A. I should always make sure to clean my peritoneal catheter insertion site with alcohol and a sterile dressing to keep the site clean. B. It's important to change the dialysate bag once a week to avoid contamination. C. I need to wash my hands thoroughly before handling the catheter, and I should always use sterile technique when accessing the catheter. D. I can continue to take my antibiotics if I notice redness or swelling of the catheter site without consulting my doctor. Answer. C. I need to wash my hands thoroughly before handling the catheter, and I should always use sterile technique when accessing the catheter. Explanation. Proper hygiene and sterile technique are critical in preventing infections related to peritoneal dialysis. The patient must wash their hands thoroughly and use sterile techniques when accessing the peritoneal catheter to avoid introducing pathogens that can lead to peritonitis, a potentially life-threatening infection. Option is not entirely correct, as alcohol should not be used for cleaning the catheter insertion site, as it can irritate the skin and tissue. A recommended antiseptic solution is usually used. Option B is incorrect because dialysate bags are typically changed daily, not once a week, to prevent infection. Option D is also incorrect, as the patient should always consult their doctor before taking any antibiotics, especially if there are signs of infection. Self-medication can lead to complications, including antibiotic resistance. Question 12. Mr. Roberts, a 65-year-old patient with chronic kidney disease, is undergoing his third hemodialysis session. He has been experiencing fatigue and dizziness during the treatment. His blood pressure is noted to be 90/50 mmHg and his pulse is 110 bpm. Which of the following interventions should the nurse implement first to stabilize Mr. Roberts? A. Increase the blood flow rate to improve circulation and stabilize blood pressure. B. Decrease the ultrafiltration rate to prevent further fluid loss and improve blood pressure. C. Administer a dose of intravenous furosemide to manage fluid overload. D. Position the patient in a Trendelenburg position to improve circulation to vital organs. Answer. B. Decrease the ultrafiltration rate to prevent further fluid loss and improve blood pressure. Explanation. The primary concern in this scenario is Mr. Roberts' hypotension, which is likely due to excessive fluid removal during dialysis. Decreasing the ultrafiltration rate is crucial to prevent further fluid loss, which can exacerbate hypotension and lead to other complications like dizziness and fatigue. Option: increasing blood flow rate would not help. Increasing the flow rate would lead to more fluid removal, worsening hypotension. Option C: administering intravenous furosemide is not appropriate here because Mr. Roberts does not appear to have fluid overload. Instead, he is likely experiencing hypovolemia due to excessive fluid removal. Option D: Trendelenburg position is an outdated practice for hypotension and has not been shown to improve outcomes significantly. The first-line approach should be to adjust the dialysis parameters, particularly the ultrafiltration rate. Question 13, MS. Thompson, a 50-year-old patient on peritoneal dialysis, has noticed that her dialysate fluid appears cloudy. She reports mild abdominal pain and a low-grade fever. The nurse suspects peritonitis. Which of the following actions should the nurse take first? A. Increase the dialysis exchanges to flush out the infection. B. Discontinue the dialysis exchange and collect a sample of the cloudy fluid for culture. C. Administer broad-spectrum antibiotics intravenously before the next dialysis session. D. Encourage the patient to increase fluid intake to flush out the infection. Answer: B. Discontinue the dialysis exchange and collect a sample of the cloudy fluid for culture. Explanation: cloudy dialysate fluid, along with symptoms like abdominal pain and fever, suggests peritonitis and infection of the peritoneum. The nurse should first stop the current dialysis exchange, collect a sample of the cloudy fluid for culture to identify the pathogen, and then start broad-spectrum antibiotics to treat the infection. Optional: increasing dialysis exchanges is not appropriate during a suspected infection, as it may introduce more pathogens into the peritoneal cavity. Option C: administering antibiotics before dialysis might be appropriate once a diagnosis is confirmed, but the first step should always be to collect a culture. Option D: encouraging fluid intake is ineffective in treating peritonitis and does not address the need for antibiotics and appropriate infection control. Question 14. A 60-year-old male patient with chronic kidney disease is starting peritoneal dialysis (PD). The nurse is discussing the procedure with him and reviewing potential complications. Which of the following statements indicates that the patient understands the potential complication of peritoneal dialysis-related hernia? A. I should avoid lifting heavy objects and straining during bowel movements to prevent a hernia. B. If I feel any pain in my abdomen, I should immediately stop the dialysis exchange. C. A peritoneal dialysis does not put me at risk for developing a hernia, so I don't need to worry about it. D. Hernias related to peritoneal dialysis are usually treated by increasing the dialysate volume. Answer: A. I should avoid lifting heavy objects and straining during bowel movements to prevent a hernia. Explanation: peritoneal dialysis-related hernias can occur due to increased intra-abdominal pressure from the infusion of dialysate. Patients should be instructed to avoid activities that increase abdominal pressure, such as lifting heavy objects and straining during bowel movements, to minimize the risk of hernia formation. Option B is incorrect because mild abdominal discomfort may occur during PD exchanges, but it doesn't necessarily indicate a hernia. A proper evaluation is needed before stopping the exchange. Option C is inaccurate, as peritoneal dialysis does increase the risk of hernias due to the pressure exerted by the dialysate. Option D is incorrect, as hernias are not treated by adjusting dialysate volume. Surgery is often required to repair hernias once they develop. Question 15. A 70-year-old patient with end-stage renal disease is experiencing restless leg syndrome (RLS) during dialysis. The nurse notes that the patient is agitated and has difficulty sitting still. Which of the following actions should the nurse take first? A. Administer a benzodiazepine to help the patient relax. B. Increase the dialysis flow rate to reduce symptoms of RLS. C. Encourage the patient to perform leg exercises or stretch during dialysis. D. Administer a dose of opioids to relieve the discomfort caused by RLS. Answer: C. Encourage the patient to perform leg exercises or stretch during dialysis. Explanation: restless leg syndrome (RLS) is a common condition in patients undergoing dialysis, often caused by imbalances in iron electrolytes and blood flow. Encouraging leg exercises or stretching during dialysis helps relieve symptoms and improves circulation. Optional: administering a benzodiazepine is not recommended for treating RLS because it does not address the underlying cause of the condition. Option B, increasing dialysis flow rate, is not the most appropriate response as it might not have any impact on RLS symptoms. Option D, administering opioids is not appropriate for managing RLS as opioids are not typically used for this condition and could have undesirable side effects. Question 16. A 55-year-old female patient with end-stage renal disease (ESED) is receiving hemodialysis 3 times a week. During a routine assessment, she complains of muscle weakness, tingling sensations, and difficulty breathing. The nurse reviews her latest laboratory results and finds that her potassium level is 6.8 meckel. Which of the following interventions should the nurse implement first? A. Administer sodium polystyrene sulfonate, K-oxalate, orally to low potassium levels. B. Prepare to administer ammonium gluconate to stabilize cardiac membranes. C. Instruct the patient to avoid high potassium foods and fluids. D. Increase the dialysis blood flow rate to enhance potassium clearance. Answer. B. Prepare to administer ammonium gluconate to stabilize cardiac membranes. Explanation. The patient is experiencing hyperkalemia, potassium level 5.0 meckel, which can cause life-threatening cardiac arrhythmias. The immediate intervention is to administer ammonium gluconate as it stabilizes the cardiac membrane and prevents fatal arrhythmias. Opsuazole K-oxalate is used to remove potassium, but it works slowly and is not the first priority in an emergency. Option C, dietary restrictions, is an important long-term strategy but does not address the immediate threat. Option D, increasing dialysis flow rate can help remove potassium but is not the first-line emergency intervention. Question 17. A nurse is caring for a 48-year-old male patient who is undergoing peritoneal dialysis at home. He calls the clinic to report that his effluent dialysate drainage is cloudy and that he has mild abdominal pain and fever. What is the nurse's priority intervention? A. Instruct the patient to increase peritoneal exchanges to help clear the infection. B. Advise the patient to drink more fluids to flush the system naturally. C. Recommend over-the-counter pain relievers for abdominal discomfort. D. Instruct the patient to immediately bring a sample of the effluent for culture and sensitivity testing. Answer. D. Instruct the patient to immediately bring a sample of the effluent for culture and sensitivity testing. Explanation. Cloudy dialysate with abdominal pain and fever suggests peritonitis, a serious infection requiring prompt treatment. The first step is to obtain a culture of the effluent to identify the causative organism before starting antibiotics. Optional increasing dialysis exchanges is not appropriate as it may worsen the infection. Option B, drinking fluids, does not address the infection. Option C, pain relievers, does not treat the underlying cause. Question 18. A 65-year-old male patient with ESED is undergoing hemodialysis when he suddenly becomes unresponsive. The cardiac monitor shows a systole. What is the nurse's first action? A. Perform rapid fluid bolus to improve circulation. B. Check for responsiveness and call for emergency assistance. C. Increase the dialysis blood flow rate to improve perfusion. D. Administer 1 mg of epinephrine Roman O immediately. Answer. B. Check for responsiveness and call for emergency assistance. Explanation. A systole is a medical emergency that requires immediate CPR and advanced cardiac life support ACLS interventions. The first step is to confirm a responsiveness, call for help and begin CPR. Opsuazole bolus is inappropriate because fluid overload is often a concern in dialysis patients. Option C, increasing dialysis rate, will not help in a systole. Option D, epinephrine is part of ACLS, but basic life support BLS must be initiated first. Question 19. A dialysis nurse is assessing a patient's arteriovenous fistula for patency. Which of the following indicates problem with the access site? A. Continuous whooshing sound is heard over the fistula. B. Thrill vibration is felt over the fistula upon palpation. C. The patient reports numbness and tingling in the arm with the fistula. D. The skin over the fistula is warm and slightly reddened. Answer. C. The patient reports numbness and tingling in the arm with the fistula. Explanation. Numbness and tingling may indicate Steele syndrome, where blood flow is diverted away from the hand, leading to ischemia. This requires immediate evaluation. Options B. Bruit and thrill are normal findings that indicate the fistula is functioning properly. Option D. Warmth and redness could indicate a minor irritation but is not necessarily a critical issue. Question 20. A dialysis patient reports feeling lightheaded and nauseous during treatment. The nurse notes that his blood pressure has dropped to 85/50 mmHg. What is the priority intervention? A. Increase the ultrafiltration rate to remove more fluid. B. Place the patient in Trendelenburg position, feet elevated. C. Administer a bolus of normal saline. D. Stop the dialysis session immediately. Answer: C. Administer bolus of normal saline. Explanation: the patient is experiencing hypotension likely due to excessive fluid removal. Administering a normal saline bolus helps restore blood volume and stabilize blood pressure. Optional increasing ultrafiltration would worsen hypotension. Option B. Trendelenburg position is not always effective. Option D. Stopping dialysis may be necessary if symptoms worsen, but fluid resuscitation is the first step. Question 21. A nurse is teaching a patient about phosphorus management in chronic kidney disease. Which of the following statements indicates the patient understands the teaching? A. I should avoid dairy products and processed foods because they are high in phosphorus. B. I can take my phosphate binder medication whenever it is convenient during the day. C. As long as I take my phosphorus binders, I don't need to worry about my diet. D. I should take my phosphate binders on an empty stomach for best absorption. Answer A. I should avoid dairy products and processed foods because they are high in phosphorus. Explanation: patients with kidney disease must limit phosphorus intake. Dairy, processed foods, and colas contain high phosphorus levels. Option B is incorrect because phosphate binders must be taken with meals. Option C is incorrect because diet control is still necessary. Option D is incorrect because phosphate binders work best when taken with food. Question 22. A patient on dialysis develops pruritus itching. The nurse explains that this is likely due to A. Hyperkalemia, B. High phosphorus levels, C. Fluid overload, D. Infection. Answer: B. High phosphorus levels. Explanation: pruritus in dialysis patients is often due to hyperphosphatemia, which leads to calcium phosphate deposits in the skin. Option quiz: hyperkalemia is not a cause of itching. Option C. Fluid overload can cause edema but not pruritus. Option D. Infection is possible but not the most common cause. Question 23. A nurse is monitoring a patient for signs of dialysis disequilibrium syndrome (DDS). Which of the following symptoms would be most concerning? A. Headache and confusion. B. Increased thirst. C. Muscle cramps. D. Bradycardia. Answer: 8. Headache and confusion. Explanation: DDS occurs when rapid fluid shifts cause cerebral edema. Symptoms include headache, nausea, and confusion. Severe cases can lead to seizures. Option B. Thirst is not a sign of DDS. Option C. Muscle cramps is common in dialysis but not specific to DDS. Option D. Bradycardia is not a primary symptom. Question 24. A 62-year-old female patient with chronic kidney disease (CKD) Stage 4 is receiving dietary counseling. She asks why she needs to limit her protein intake. What is the best explanation the nurse can provide? A. The high-protein diet can cause fluid retention, which can worsen kidney disease. B. Your kidneys cannot efficiently remove the waste products of protein metabolism, leading to toxic buildup. C. The too much protein can cause your body to produce excess sodium, increasing your blood pressure. D. Reducing protein intake will help increase your urine output and slow disease progression. Answer: B. Your kidneys cannot efficiently remove the waste products of protein metabolism, leading to toxic buildup. Explanation: in CKD, the kidneys lose the ability to filter nitrogenous waste products, e.g. urea creatinine, that come from protein metabolism. This leads to azotemia, high blood urea nitrogen levels, metabolic acidosis, and worsening kidney function. Option is incorrect. Protein does not directly cause fluid retention. Option C is incorrect. Protein does not cause excess sodium production. Option D is incorrect. Reducing protein does not directly increase urine output. Question 25. A dialysis patient is prescribed erythropoietin therapy (epoetin alpha) to treat anemia. What should the nurse monitor closely to prevent complications? A. Blood pressure. B. Blood glucose levels. C. Potassium levels. D. Urine output. Answer A. Blood pressure. Explanation: erythropoietin therapy stimulates red blood cell production, which can lead to increased blood viscosity and elevated blood pressure. Patients receiving this treatment are at higher risk for hypertension, stroke, and cardiovascular events. Option B, glucose levels is not affected by erythropoietin. Option C, potassium is important in dialysis patients but not directly affected by erythropoietin. Option D, urine output is not a concern because most dialysis patients produce minimal urine. Question 26. A nurse is assessing a hemodialysis patient's vascular access site, arteriovenous fistula. Which finding requires immediate intervention? A. Loud bruit and palpable thrill at the access site. B. The patient reports cold, numb, and weak hand on the fistula side. C. Small amount of redness around the needle insertion site. D. The patient's blood pressure is slightly lower than usual after dialysis. Answer. B. The patient reports a cold, numb, and weak hand on the fistula side. Explanation. These symptoms suggest Steele syndrome, a serious condition where blood is diverted from the hand, leading to ischemia, lack of blood flow. This requires immediate evaluation and potential surgical intervention. Option was a bruit and thrill is a normal finding. Option C, mild redness, is common and usually not urgent. Option D, slightly lower BP is expected after dialysis due to fluid removal. Question 27. A patient with end-stage renal disease (ESSA) develops severe metabolic acidosis. The nurse expects which of the following laboratory findings? A. pH 7.32 HEO 12 mecl PO 28 mHg. H 7.48 HEO 28 mecl PO 42 mHg. C. EH 7.40 HCO 24 mecl PO 4 mHg. D. EH 7.28 HEO 30 mecl PO for 30. Answer A. pH 7.30 HEO 12 mecl POCO 28 mHg. Explanation. In metabolic acidosis, there is low EH 7.35 and low bicarbonate HEO 22 mecl. The body compensates by hyperventilating to decrease POCO, partial pressure of carbon dioxide, which is why it's also low in this case. Option B is metabolic alkalosis, high HIHEO. Option C shows normal acid-base balance. Option D suggests respiratory acidosis, low pH, ICMA. Question 28. A patient undergoing peritoneal dialysis at home reports severe abdominal pain, nausea, and cloudy effluent drainage. What is the nurse's first action? A. Instruct the patient to stop dialysis and go to the emergency department. B. Obtain sample of the dialysate effluent for culture and sensitivity. C. Administer an anti-nausea medication and reevaluate in an hour. D. Encourage the patient to drink more fluids to flush out the infection. Answer. B. Obtain a sample of the dialysate effluent for culture and sensitivity. Explanation. These symptoms indicate peritonitis, a serious infection requiring immediate treatment. The priority is to obtain a sample for culture and sensitivity to determine the appropriate antibiotic therapy. Option or stopping dialysis may be needed later, but diagnosing and treating the infection is first. Option C. Anti-nausea meds does not address the infection. Option D, drinking fluids, will not treat peritonitis. Question 29. A dialysis nurse is providing discharge teaching to a patient with a new peritoneal dialysis catheter. Which statement by the patient indicates a need for further teaching? A. I will wash my hands before touching my catheter to prevent infection. B. I should notify my doctor if my dialysate drainage looks cloudy. C. I can take a bath as long as I keep the catheter site covered with a waterproof dressing. D. I should avoid constipation by eating fiber and using stool softeners as needed. Answer. C. I can take a bath as long as I keep the catheter site covered with a waterproof dressing. Explanation. Patients with peritoneal dialysis catheters should avoid baths because submerging the catheter increases the risk of infection. Showers are safer with proper catheter site protection. Optionals and hygiene is correct. Option B, cloudy effluent reporting, is correct. Option D, avoiding constipation, is correct, as constipation can block dialysate flow. Question 30. A patient receiving hemodialysis suddenly develops shortness of breath, chest pain, and a feeling of impending doom. The nurse suspects an air embolism. What should the nurse do first? A. Stop dialysis immediately and place the patient in Trendelenburg position, head down, left side. B. Administer oxygen and increase the dialysis blood flow rate. C. Notify the provider and continue monitoring the patient. D. Prepare for immediate defibrillation and start chest compressions. Answer: A. Stop dialysis immediately and place the patient in Trendelenburg position, head down, left side. Explanation: an embolism is a life-threatening emergency in dialysis patients. The first action is to stop dialysis, place the patient in Trendelenburg position on their left side, and administer oxygen. This position helps trap air in the right atrium, preventing it from reaching the lungs. Option B. Increasing dialysis flow can worsen the embolism. Option C. Monitoring delays treatment. Option D. Defibrillation is only needed if cardiac arrest occurs.